I think most people understand that we're asking those on the higher rate and the top rate to pay a penny more to invest over £1 billion in the health service and the health and social care. I think people understand the reason for the challenges of the health service. What they want to see is a commitment from the government to continue to invest in that health service to improve it. We can't improve the health service without that additional funding, and that's why it's so important. We had that progressive budget from John Swinney yesterday, which, as I say, asks those in the higher rate and the top rate to pay that penny more in order to invest over £1 billion in a health service. Just through inflation alone, my budget this year, this financial year, is worth £650 million less. Now, we're having to try to mitigate the impact of the UK government's economic incompetence. So I would always urge the UK government to continue to invest in our public services as opposed to the current path they're on of austerity. If they do that, then of course there'll be further consequentials coming our way, and we've always made a commitment to pass on health and social care consequentials in full to health and social care here in Scotland. So we'll certainly do what we can, and you've seen that John Swinney is using the tax powers in our gift to try to increase investment in our public services. But of course, I'd urge the UK government to do the same. The situation we're in is an extremely challenging winter. This week alone has been, I think, probably the most difficult our NHS and emergency departments have ever faced because of the rise in flu cases, strep A, viruses, but also the bad weather. Prolonged bad weather, we know, means slips, trips and falls. So this winter, as I've said to you before, we'll see fluctuations in performance, and that's going to be the case, I suspect, right across the UK. In terms of the next financial year, of course, additional funding is always going to be welcome. It's going to help us to make inroads into the backlogs. So I expect to see improvements in those who've been waiting for operations or surgery. I expect to see improvements in mental health in terms of reducing the waiting list. I expect to see improvements in A&E performance as we get into as we get past the winter and the worst of it. And so I expect to see improvements right across the system, and this additional investment will help with that. To invest in our public services, and this is part of the social contract that we have with people. That allows us to put on the table also record high pay deals, so that those, including those that are in the higher rate, for example, getting an increase in their pay during a time of this cost crisis. So it allows us to do that as well as invest in our public services. But I understand those anxieties, but I hope people understand that we're not raising taxes willy-nilly. It's being done to invest particularly in our NHS and social care, which will get an over £1 billion boost next financial year. We always want to try to meet our targets, and in the 31-day target, the 95% target, we just missed it. I mean, 94.3. So we're not far off. So that means that over 9 out of 10 people are being seen within that 31-day pathway. What I would say is we are seeing more people, so we'll do what we can to maximise capacity, but know that our focus will always be on those that need that most urgent care, that most urgent treatment and support. So hopefully when it comes to cancer, people will see through the investment that we're making that cancer is the priority, making sure that those with cancer or suspected cancer are getting the diagnosis first and foremost that they need rapidly, and then of course getting the treatment and the aftercare they need thereafter.